As a psychiatrist specializing in OCD, one of the most common questions I get from my patients is this. Is what I'm experiencing anxiety or is it OCD? So in today's video, we'll be exploring that question. For those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board certified psychiatrist. And on this channel, I enjoy making mental health educational videos. But of course, if you are experiencing any mental health symptoms, this does not replace you seeking mental health care. And please seek the care of a local mental health provider. But before we talk about OCD, let's talk about anxiety. And first of all, I think it's important to clarify that anxiety in and of itself is not a disease, it's not a disorder, it's a natural part of being human. We all experience it. When it does become a concern for us mental health care providers, and of course very distressing to my patients, is when it becomes very persistent, overactive, and you're on alert, anxious, in this anxious state much more than would be expected given your circumstances. Or maybe even it is very elevated given your circumstances, but it's causing you distress and impairing your ability to function day to day. So next, let's talk about what makes OCD, obsessive compulsive disorder, so different. I kind of describe OCD as a type of anxiety that gets very specific about a certain worry and very repetitive, very ruminative. That's not a perfect definition. I'll go into some more specifics. I won't go through all the DSM criteria. You can easily Google that yourself. But I'll fill you in how an OCD specialist like myself screens for and sort of identifies OCD and explains it to their patients. Like I just hinted at, OCD tends to latch on to something you care about, and then keep coming back to it. So your thought, your attention continues to gravitate back towards the certain stressor, the certain thought, anxiety, sensation. And it's just really hard to move past it. Let's go through some examples. So probably the one that most people are familiar with when they think of OCD is contamination OCD. There are different forms of OCD, there's almost endless varieties of it. And contamination OCD is the one where people, they recurrently wash their hands. There's a fear of touching a surface, germs, things like that are then accompanied by recurrent compulsions to cleanse themselves. Probably the most commonly portrayed one on TV and in movies. That's why most people are so familiar with it. But it does illustrate OCD quite well because there is this very persistent anxiety. Something is contaminated. I'm contaminated. My space is contaminated. So it's a very specific worry that's also accompanied by a sense of uncertainty. I'm not sure if it's fully clean yet. So let me address this anxiety by washing my hands, my environment, and maybe it reduces the anxiety for a little bit, but then it comes back. I believe if OCD had its own thesis statement, it would be this: repetitive anxiety and worry about a specific uncertainty. And I'll come back to that in a little bit. But next, let's look at the two things I screen for when assessing someone for OCD. I ask this: is there a recurrent theme to your anxiety? Do you have anxious thoughts that tend to revolve around a very specific or certain topic? Does your mind continue to return to the same fear? And then sometimes if they struggle with this, I'll also be a little bit more specific and maybe even give us some examples like contamination, health, relationships, worry about harming someone or harming yourself, morality, religion, responsibility, all things that you care about. Basically anything you care about in your life, OCD has the opportunity to latch on to. And once I get a sense of this, I then ask them, what do they do when this anxiety comes up? I try to get an understanding of how do they respond to the anxiety. This is kind of where the compulsions come into play. And the easy compulsions to spot are the physical ones, right? So checking if your door's locked 20 times, checking if the stove is off 30 times before you go to bed, turning lights on and off multiple times until it feels right, washing your hands, asking reassurance from people about various things to an excessive extent. And compulsions can also be mental. And these can be a little bit harder to detect. And this can involve things like coming back mentally to a thought, to something you did, to something you may have thought in the past, or just analyzing how you internally feel about something over and over again. A lot of checking in with oneself, thinking about your own thoughts. And the paradoxical nature of compulsions is this: the more you engage in them, sure, some of the anxiety goes down very temporarily, but then it reinforces the cycle. It worsens the OCD and it makes the anxiety keep coming back stronger and louder and more frequently. Let's go through an example that I think most people aren't familiar as being a part of OCD. And that's something like harm OCD. So intense obsessions around worry, fear, or uncertainty that you may harm someone, have harmed someone, or maybe will harm yourself in the future. To be clear, a lot of people have intrusive thoughts. Some of these obsessions come up and they don't have OCD. It's like a common one is standing at the edge of a tall building or something, right? You look down, you might have the thought, what if I jumped? Or you see a sharp knife and you think, what if I cut myself? And then that's it, right? The thought is sort of fleeting, it goes away. In OCD, you get very obsessed with these kind of thoughts. They keep coming back and it's very hard to move past them. And OCD may say, why did I think that? What does this mean? Does this mean I'm dangerous? Will I hurt someone? Will this potentially lead to an action that will irrevocably change my life? And these thoughts become very dominating. And some of the compulsions here that might not be so visible and evident can be things like avoidance. So maybe not watching movies where there's violence, not driving because of fear of you might swerve off the road intentionally or unintentionally. People may hide all the sharp objects in their home. Even though they have no intention of harming themselves, the anxiety and uncertainty over whether they will or not is strong enough that they feel compelled to do so. So now this brings me to discussing what's the real fuel, what's the real propagator of OCD. And it really comes down to the fear of uncertainty. The majority of OCD involves a high anxiety over knowing, or I guess I should say not knowing, an outcome in the future or something from the past that may happen and irrevocably change your life. It's believed that there's a system in the brain that allows for certainty, allows you to sort of be confident enough in something and then move on with your day, with your thoughts. And in OCD, there's a disruption there and you get kind of stuck on repeat. And so you can't feel certain about a specific thing, and sometimes it can even affect multiple parts of your life. So you can have OCD related to multiple themes as well. Of course, I can tell you as an OCD specialist, there are a lot of very effective treatments, and all of my patients do get better with time. And that involves ERP, exposure response prevention, ACT therapy, CBT, along with medication management. And these things do get better, but it's certainly not easy. It can take some time. Let's return back to that relationship between anxiety and OCD, right? I kind of talked about how there's a very general form of anxiety, and then there's a very specific form of anxiety, which is we call OCD. And I would say, I think of OCD as living on a spectrum, all anxiety sort of being on a spectrum. I think personally, all mental health conditions exist on a spectrum. Most psychiatrists, I would say, agree with that as well. And OCD is no different. And many people with generalized anxiety may also have OCD as well. And the OCD may vary in intensity throughout life. The generalized anxiety may vary throughout life as well. There is a lot of research and just clinical evidence showing too that if you do have generalized anxiety, one form of anxiety, you are more predisposed to other forms of anxiety as well. So the main takeaways I hope from this video are this. Anxiety in general is normal, but when it becomes excessive and disruptive to your life, then that's when we start to consider whether it's a part of a disorder. And OCD is a form of anxiety that can be highly focused and repetitive, oftentimes revolving around the fear of uncertainty. Of course, I'd love to hear from everyone out there. What questions do you have about OCD, about anxiety? I'd love to answer them in the comments or in future videos. And thank you so much for watching to the end. I really appreciate it. Please consider liking and subscribing. Any comments, interaction really goes a long way. And I hope to see you next week for another mental health video. Thanks and have a good week.